Perfect. So we've heard already today about the importance of, in the early years, particularly physical activity, but it's really important when we're talking about children 0 to 6 that we have our science hat that says physical activity, but that we understand that means play. And hands up in the audience who remembers the first time they skipped, that they were able to skip with the skipping rope. Good, and you probably felt it in a great sense of achievement and success and happiness that you were able to finally skip. And hands up who remembers the first time that they climbed just a little bit further, either a tree, or it might have been a ladder up to a slide, or it might have been something in their house they shouldn't have been climbing. Good. And so this is the logo from the ECOG, which is the European Childhood Obesity Group, and just to remind us that the sense of play is vital for children for many reasons I'll go through now in a moment. But in order to be able to play freely, we need building blocks for that, and not just at an individual level ourselves, but also in the society that we live in. So we know that play, and I'm going to intersperse play with movement or activity, but maybe try and not think of physical activity in terms of METs or minutes or steps, and just try and focus on the idea of play, because from a public health point of view, we have to be very careful that when we're talking about promoting activity in early children, that we don't alienate parents and children themselves by this kind of emphasis on time and quantity, because the main goal of playing is to have joy, to have pleasure, to have experience freedom, often away from parents, to have a sense of being able to be creative and to be able to take risks. And the adventure and the risk piece, there is some data showing that when we modify the environment and put in, let's say, playgrounds or play equipment, that we have to be very careful about the adventure and the risk, because we've moved very far towards minimizing risk in terms of litigation. But that experience of risk from a young age of developing children is really important, because we all have to understand what happens to us when we meet a risk and how we manage to minimize that risk. So we know that active children have improved levels of blood pressure, lower levels of lipids, and better cardiorespiratory health, but also better self-esteem and emotional health and social skills. And unfortunately, at the moment, according to the WHO, we have about 42 million children under 5 who are overweight or obese. And that activity level in children in the early years, from the UK, 54% of children in those early years were reaching the recommended level of activity. And in that study, it was at 120 minutes a day. So that's 1 hour of structured play and 1 hour of unstructured play. And that's something, I'll go through the guidelines in a minute. But just to think about, when we come out of the womb, all of us, we're fully dependent on our parents, and we go through life and we start to develop, our nervous system starts to integrate, and we start to be able to develop very complex motor tasks as we begin to be able to have tummy time, start to control our head, start to reach and grasp, move towards actually being able to support our body in prone positioning, so tummy time, which is really, really, really essential for anybody working with families promoting tummy time. Learning how to roll, starting to vocalize and integrate kind of speech systems as well. Moving towards crawl and unsupported sitting and throughout. So we're going to go through a little, I want you to think about these steps as we move forward. The data in Ireland looking at participation in sports and activity, this is from a survey done recently with the children's sports participation. And unfortunately, primary school children in blue and secondary school in red, just slightly less than 20% of primary and post-primary school children were reaching their active, and that was actually at 60 minutes a day of moderate to vigorous activity. And I know there's many of the co-investigators in this report are here today, so I'd like to congratulate them on this great piece of work. But becoming physically active has many determinants, and we've talked about social determinants. So whether you're living in a city like Jerusalem, where you maybe can't go out on the street to play depending on your ethnicity, or indeed areas of Dublin where it may not be safe all around the country, deprived areas where it may not be safe for children to be out playing on their own. But the building block of motor development also has determinants. And the ones that have been reported in the literature to date include that there is partial genetic control. So we do see that different ethnicities, that children develop slightly differently in terms of how early they become integrated. And I was lucky enough a couple of years ago to spend a little bit of time in the Amazon, and I was really, really, really struck by watching 2 and 3-year-old little infants, toddlers, by the river's edge, jumping into a little canoe at 5 years of age themselves, rowing to school with their little school bag on their boat. And I thought, what are we doing to our children in the West? And for that ethnicity, it's usually white children that tend to develop later. The duration of breastfeeding has also been seen to be an important factor in terms of motor development. So if you're breastfed for longer, that you'd have earlier motor development. And low birth weight and prematurity we already spoke about, and this is really essential because many of us who are working in healthcare, we're very often seeing charts of children who are born premature. It's becoming more and more common in terms of we're medically able to look after these kids, but they are at much greater risk in terms of they come out of the womb slightly early, their nervous system isn't integrated, and it's much harder for them to develop on time. Parenting practices have a huge impact on this. So whether we allow our children to play, whether we're trying to wrap them up in cotton wool, whether we're using baby walkers. So for all of anybody working with parents, no to baby walkers. They slow down motor development and they increase the risk of injury. So we can speak about motor experience then as having physical literacy. So like we would build up our arithmetic and reading literacy in our early years, and we do that by practice and reading with children and practicing words, so too with physical literacy. And having someone to do it with obviously is really, really important. But again, enjoying play, and we know that when we enjoy something, we feel more competent at it, and if we're more competent at something, we tend to carry it on and feel like we build self-efficacy, we feel like we can do it, and we carry on through life. And there is some evidence that motor competence early in life will carry through to teenage years, and children who found activity easier will become more active adolescents. So our motor passioning, our motor development really does start in utero, and it was great to hear some of the work around the antenatal period, because of course maternal and paternal nutrition is really important, but the physical activity of the mother with the developing fetus is vital as well for fetal programming. And that early life experience of having a newborn baby who maybe came on term and comes into the world, and how different that is for that little premature baby who comes into the world earlier. They're exposed all of a sudden, instead of a nice safe womb, to bright lights and noise and overstimulation. And of course we can understand how that little baby would develop slower. Moving through now from infants towards kind of the most part of the literature that's been looked at, the area that's most described as fundamental movement skills. So the developmental period between 0 to 2 years is vital, and then the next 3 years again incredibly vital if we're going to try and have an effect on activity level throughout childhood. So the WHO, just around the gross motor milestones, finishing off this piece, WHO has we all have our national developmental motor milestone kind of itinerary that we think is normal or abnormal. And I like to use the word typical and atypical rather than normal, because you can see that there's a huge age range of when is considered normal for developing these motor skills, and we have to remember that. So for the kind of in the literature, the biggest ones that we see as outcomes are independent walking, so walking alone, or supported walking with a parent, and sitting without support. So on average, we generally would think about 6 months, which is around about the median, 12 months for walking alone. But really, 18 months is still within the norm, just at the upper tail end of being delayed. So important to bear that in mind when you're dealing with little babies. So again, from the literature, so what does the literature say about motor development and obesity? Well, there's been not a huge amount of studies really. There's five or six. I did a systematic review over the last few weeks to look at this data. So one Danish cohort study looked at 25,000 children and found that the infant motor development, which was delivered by parental report, so the parent reported what age the baby was when they walked unsupported, and that there was no greater risk of obesity with later development, and that's by a parental subjective report. In this US-based study of 741 infants, this was objective measurement with the Bailey scale, which many of the people in the audience will be accustomed to, and that found that if the baby rolled later, sat later, or walked later, that yes, there was a significant risk of increased adiposity at 3 years. Then we also there's a systematic review looking at the association of higher infant weight and delayed motor development, and we certainly would see that in practice, that if there's children who are gaining weight quicker, they aren't able to develop the muscle force to move their heavier body, and they tend to be delayed. That's an empirical evidence from my opinion, but from the systematic review, 9 studies did show that this was positive and 2 showed that this was not positive. Another birth cohort, this is a Finnish birth cohort, found that earlier walking actually predicted motor performance in adulthood. So this was in people in their 50s, that babies who walked sooner tended to be more strong and have better performance as adults. This is another birth study in the Finnish birth cohort, and they found that they wanted to look at, how about motor development and activity in adolescence, because we know at adolescence that's the key time when children, boys and girls, but particularly girls, become less active. And is there anything in the data that would, in their birth cohort, that would show an impact of motor development? And they did find that if you walked earlier, or if you stood unaided earlier, that you were more likely to be involved in sports as an adolescent, and that you'd be involved with a range of sports, and that was significant too. So just to kind of recap on the guidelines for any of you out there, because the 1 hour of moderate to vigorous activity per day is for over 5s, so 5 to 18 years. And in younger children, so 1 to 5 years, the current guidelines, based on systematic review and meta-analyses from a lot of groups, but particularly the Canadians have done a lot of work around this, 3 hours a day. And that's not obviously 3 hours in a row, but lots of little short bouts, 10 to 20 minutes throughout the day for children 1 to 5. And then for babies, we're really looking for lots of tummy time, lots of interaction with the child, trying to encourage grasp, reach, pushing, pulling. And for 5 to 10, 15 minute little bursts of activity, obviously depending on the age of the baby, and then building up towards 3 hours a day as well. So moving on then to children as they're getting older, developing the really complex skills of being able to be buoyant in water, being able to jump, learn life skills, learning how to play and form social relationships, and then learning to ride a bike, which is very complex in terms of motor development. So we move towards what we call fundamental motor skills, and in the literature this is what you'll hear a lot about, fundamental motor skills, which are the building blocks to advanced movement and play. And these are normally divided into object control skills, so whether we can control a ball or a bat or a racket, and locomotor skills, so whether it might be crawling or walking, jumping, hopping, skipping, and also non-locomotor, so we're static in one place but that we're able to maintain balance. And really important to remember, so we know that there's genetic priming for motor development as a baby. Babies in the womb kick, they come out within the first few weeks of birth, of life, they're already practicing reciprocal synchronous movements. It's a genetically primed thing. But in older children, these fundamental motor skills do not develop naturally. We have to practice them and reinforce them, and it's the idea of specific adaptation to imposed demand, that our physical body as a human reacts to what we're exposed to. So lots of children are entering adolescence now without the fundamental motor skills, so we wonder why they're not active. And if you're not able to bounce a ball or kick a ball, of course you're not going to want to be in GAA. If you don't have good hand-eye coordination, of course you're not going to want to do hurling. And often in our schools there's not a huge range of sports and games that children are able to play. This is from, again, systematic reviews looking at do impaired fundamental motor skills in young children, so usually between 3 and 5 years, do they affect later health? And we know that the children with impaired skills are more likely to be overweight, they're less likely to be active and less fit. So in this meta-analysis, there was 33 studies that looked at the impact of fundamental motor skill on body weight, and of those 81%, there was strong evidence that there was a negative effect. So if you're impaired motor skill, more likely to gain weight, which makes sense because it's harder to move. Also, the cardiorespiratory fitness was negatively affected. So if you're impaired from a motor development and fundamental motor skill point of view, it's harder to move enough to become fit. So for your cardiorespiratory fitness, strong evidence there. 100% of the studies of RCTs looking at this have found that. And then also musculoskeletal fitness. So 63%, 64% of the studies looking at whether if you have impaired motor skill, whether it affects musculoskeletal fitness. So that's strength, balance, flexibility, coordination, balance. And yes, very strong evidence. So the conceptual model that's kind of been proposed is if we are to be active as older children and adolescents and adults, what's really important is the prior activity, whether we enjoy that, and then what our perceived skill level is and what our actual motor skill level is, and then how those all integrate with physical activity and sports. I've only got 2 slides left. So we know that motor skills are really important for health, happiness, social development, social skills. We know that when we're impaired from a fundamental motor skill perspective, that it can have a negative effect on our health. But what about intervention? So are interventions working? And meta-analysis by Morgan showed that yes, by improving motor skill through either teacher-led, parent-led, or class-based interventions, that there's a really strong effect on overall gross motor skill, also on locomotor skill, and then not still on object control skill, but one study that's crossing over. So object control skill is really very important from a point of view of training, so having the right equipment and having someone to teach you those basic skills. So that's it. Yeah. Any questions?